All righty. So we're going to go ahead and get started here. All right, pull my thing up here. All right, so welcome to Children with Diabetes Friends for Life Fall 2021. My name is Matt Point, and I am the Director of Advancement here at Children with Diabetes. So thanks for joining us. We're excited to be here. And we can't wait to actually be in person again next year in 2022 in Indianapolis in April and Orlando in July and DC in next October. So make sure you check out those dates. As we go through tonight's presentation, pop any questions you have in the Q&A feature at the bottom. You'll see there's a little Q&A. You can type in the questions there. Just keep in mind, you can type them for everyone to see, or you can choose anonymously, which they will come to me and I will ask at the end. If you have any simple questions during the event, feel free to drop them in the chat, and I might answer them as we go along, or they might get answered throughout the presentation, but we will have a Q&A session at the end just in case anything comes up. But if you have any questions, feel free to pop them in. We'll make sure they get answered. So tonight I have the pleasure of introducing our speaker for the next session, Dr. Kajal, sorry, we just had that whole discussion about my student pronounced the same way, different way. Ghandi. Dr. Ghandi is an assistant professor of pediatrics and pediatric endocrinology at Nationwide Children's Hospital, The Ohio State University in Columbus, Ohio. She is a board-certified pediatrics and pediatric endocrinologist and completed her training in pediatric endocrinology from Texas Children's Hospital / Baylor College of Medicine. Her primary research interests include medical education, improving diabetes education and outcomes through quality improvement programs, as well as investigating ethnic, racial disparities in type 1 diabetes, ultimately to create a culturally sensitive diabetes education curriculum for medical providers and patients and families. She is co-medical director of the Diabetes and School Health Program at Nationwide Children's Hospital and participates in the National T1D Exchange Quality Improvement Collaborative. Thanks for joining us tonight.
Hi, everybody. Thanks, Matt, for that wonderful introduction. If we're ready, we'll go ahead and get started. I'm going to go ahead and share my screen. Let's see. It says that it's disabled screen sharing. Matt, do you know how I can share my screen? Sorry, guys, a little technical snafu.
Try again.
There we go. Okay, thanks. All right. Can you see my screen okay? I'm going to put it in presentation mode. There we go. Okay, perfect. So hi, everybody. Good evening. Thank you for joining. As Matt mentioned, my name is Kajal, and I'm one of the diabetes physicians here at Nationwide Children's Hospital. And I'm here today to talk about just a back to basics talk about the basics of diabetes care, whether you just need a refresher, or you're new to diabetes and you're newly diagnosed, or you're a caregiver and you are taking care of a loved one with diabetes, or you just wanted to come and hang out. Welcome. So I wanted to start off with just a little bit of a historical context. We know that diabetes care didn't start off with the good old days, but we've come a really long way, as you all know. So, we have a graduate student, Paul Langerhans, up on the top in the 1860s, discovered that there were these pockets of cells called islets that were responsible for controlling blood sugars. We fast forward in history, and just like we're celebrating 100 years of insulin, Dr. Frederick Banting discovered insulin in 1921. And that's what changed diabetes care forever. So from then on, we've been really catapulting our diabetes care in the last century. We went from testing urine with glucose all the way to glucose meters that have looked at various sizes, modernized to what we see today. And lo and behold, now we have continuous glucose monitors. We've had first insulin pumps that were huge, now to smaller and smaller insulin pumps that we can see, that we can or cannot see on people. And that's a really, really, really great development. And we're so excited to see how the continuous glucose monitor, which we're going to talk about later in the talk, can integrate with our pumps to control our blood sugars and help live better lives with diabetes. So before we start, I wanted to, I tell a little personal story about how, different challenges can, steer you in unpredictable directions. I want to tell you a story about a little 7-year-old girl who observed a family friend checking her blood sugar. She didn't know it at the time that she had type 1 diabetes. This was back in the 90s, early 90s. And as she was checking her blood sugar, that little 7-year-old girl got overwhelmed and passed out when she saw the blood, checking her blood sugar. And, she turned out okay. She was okay. And, that little girl with diabetes explained to everybody why she was doing what she was doing. And you might wonder, why am I telling the story? Well, that 7-year-old girl who passed out after seeing a drop of blood while that girl was checking her blood sugar was me. And guess what? I became a diabetes doctor. And so it actually really shaped who I was and what my relationship with type 1 diabetes was. And I'm really passionate about telling people that, those kinds of things can really shape who you are and that you're going to be okay. So we want to, our talk today is to help you make diabetes care easier and manageable. You're never going to you can strive for perfection, but we don't want to strive for perfection. We want to strive for progress. And we're going to talk about different aspects of diabetes care and how you can make each aspect of diabetes care better for you that can really change your life. So I wanted to start off with, what is type 1 diabetes? Sometimes we say the word type 1 diabetes all the time, but we want to make sure that you understand what that means. There's different types of diabetes. The major ones are type 1 and type 2. They used to think that they're very different, but now we think that there's probably a mixture of those types of diabetes. There's also a genetic type of diabetes, but namely type 1 diabetes means that your body does not have enough insulin for your blood sugar to be in control and for your body to effectively function. Insulin not only controls your blood sugar, it does a lot of different things and does a lot of healthy things for your body. But when you have this insulin deficiency in type 1 diabetes, what does that mean? Well, you know what? We give you what you're missing, and it is treatable. So we give you insulin. And like I had mentioned before, we want to strive for progress, not perfection. There's no such thing as perfect diabetes care. So, before I start, diabetes is a family community affair. It takes a village for one person with diabetes to become successful. And every single person in that village will have a contributory role. It could be small, it could be big, it can fluctuate over the course of that person's life or their experiences. And we want to understand that, for all children, regardless of age, sometimes it is too big of a job to help take care of your diabetes by yourself. It is great to be independent. It's great to be autonomous with your care, but sometimes you're going to fluctuate, depending on what your needs are. And it's okay to give yourself that grace. And also to know that diabetes care is individualized. We're understanding that more and more every day, is that we talk about the basics of diabetes care that we're going to talk about today, but then from that, it is individualized and your care is unique. And that's something that I, along with all the diabetes teams across the country, are starting to understand that so we can better meet your needs. So I like to divide this topic in diabetes success in all these different categories. We talk about monitoring, medication, technology, coping and psychosocial needs, complications, and then exercise, activities, and nutrition and general lifestyle. So we're going to go through all of these one by one and just talk about some basics. So let's start off with monitoring. Why do we have to monitor our blood sugars? And why do we have to monitor our insulin doses? Well, it helps keep us safe. It helps manage your lifestyle a little bit better. So the first things that you're probably going to discuss, after you're diagnosed or you're first encountering somebody who you're taking care of, is when should you check your blood sugar? It can happen before meals or snacks, before bedtime, during the night if needed. If you feel that you had some unusual activity during the day, or you had changed your insulin doses, namely your long-acting insulin, which we're going to talk about in a second, then you might want to check it during the night. Before you drive, it is super important, if you do any kind of operate any machinery, or you drive or do any of those things, that you have you don't have a low blood sugar, you don't have an elevated blood sugar or ketones. Before, during, and after you do any activity or exercise, because activity and exercise can affect your blood sugars in different ways, depending on how you eat, what type of activity that you have, and your level of fitness. When you're sick, of course, we want to make sure that your blood sugars don't fluctuate when you're sick, and they can oftentimes. And any unusual symptoms, if you're not feeling right, you're just not feeling, great, and you might think that something is off, that's a great time to double check your blood sugar. So throughout the talk, we're going to talk about different terms that you might encounter from me during this talk, or with your diabetes team, or when you were diagnosed. So we're just going to do a little refresher about some of these terms. So A1C, a hemoglobin A1C, is a measure of average blood sugar over the last 3 months. It's a great way to measure how well your blood sugars are doing, rather than just getting a random blood sugar, or just doing other tests. Now, I will talk about other things that have come into play in the last few years that could be a better measure than A1C. But right now, A1Cs are something that you get measured at your clinic, whenever you might be in the hospital, and when you were diagnosed. A Lancet is a needle device to obtain your blood sample to check your blood sugar. And we're going to talk about how to check your blood sugar. So we're going to focus on blood sugar meters. We're going to talk about another way to check your blood sugar is a continuous glucose monitor in a second. So what do you need? You need a meter, you need test strips, you need Lancets, and Lancet device. So with your meter, you want to make sure you set the date and time, and you check it every time you use it, so we know that the time and date of your blood sugar is accurate. And if it's appropriate, make sure you keep extra batteries or control solution. And you want to keep the meter and strips out of extreme temperatures, because we want to make sure they work properly. So how do we check our blood sugars? We wash our hands. We place the Lancets, the strip, and the meter. You stick your finger typically on the side, because it tends to be less sensitive there. You touch the blood to the strip, and then you read the glucose on the meter. So you want to use a new Lancet, and every time you test, and you throw away the Lancet after it is used. We don't want to reuse Lancets over and over. And then when we want to safely dispose of our sharps when it's full. So what is our glucose goal? We're monitoring our blood sugars, but what do we want to strive for? And I want to emphasize that this is going to be a little bit different depending on your diabetes provider, or the practice that you follow, or the institution that you're at. But general guidelines is that A1C, which is a percentage, meaning the higher that percentage, the higher your blood sugar is, okay? Anything above 6.5% or higher is diabetes. And so general diabetes guidelines typically say that you want 7% or lower, but without evidence of any low sugars. Okay, glucose is 70 to 120. And then of course, you can have an A1C of 7% or lower, but we also don't want to fluctuate up and down, because that can actually affect your long-term outcomes. And so this is what I was talking about, is that we have this new idea called time and range. Time and range is an idea where how much of the time that you're in, the 24 hours a day that you're checking your blood sugar through the continuous glucose monitor, how long are you in range? And we have found with this emerging technology that we can find that time and range may be a better indicator of what your risks are for long-term complications. I think researchers and institutions across the country are trying to better understand time and range, and to make it more standardized so that we can help better educate our patients and families. So it's just something that definitely to keep in mind if you hear it at one of your visits, or in any kind of focus groups or support groups. How do we keep our records? We're using technology. If we use a continuous glucose monitor, you can use meters, apps, or their own software to monitor and keep all your blood sugars together. Okay, but it's important to have these numbers to help you understand these trends and the effects of activities and illnesses on blood sugar. And I want you to help understand that we don't think of any bad or good blood sugars. Okay. Things are out of range, things are in range. You can do everything correctly and you may still be out of range, and that's okay. We just want to help understand as much as we can what happens so that we can just avoid it in the future. But sometimes we may not always be able to do that. And like I said, you want to give yourself some grace. So let's talk a little bit about technology. I know technology can be overwhelming, at first, but I think it's going to be a really big, it's playing a really big role in diabetes care now. And, we've found that, there might be some benefits to being on certain parts of technology very early on after you get diagnosed. And so part of this technology is continuous glucose monitors, and which I've mentioned. So continuous glucose monitors are basically devices that monitor glucose continuously underneath the skin. And why do continuous glucose monitors are more helpful than meters? Because as you can see, if you see on that graph, the red dots are when you check your blood sugar. So if you check your blood sugar 4 times, they all seem to be in target. But then when you put on a continuous glucose monitor that continuously measures your blood sugar, you can see that this person had a lot of fluctuation over time, which we can address and avoid any potential complications and avoid those lows that we never saw with the meter. Okay. In the last couple of years, there have been a lot of different continuous glucose monitors that have come out into the market. They range from like 7 to 14 days, and some of them work with with insulin pumps that we'll talk about later. So what do you need to consider when you think about whether you should be on a continuous glucose monitor? Some of these continuous glucose monitors have remote monitoring. So what that means is, your child or your loved one could have a continuous glucose monitor on, and they can identify other people to watch certain aspects of their blood sugar, all of it, or highs or lows, or those type of things. And then you have some security in knowing that somebody else is watching your blood sugars to keep you safe. What kind of comfort do you have with the CGM on your body? Some people's lifestyles may not be compatible with that, or if it's something that may not be something that's comfortable to you. It's just definitely something to consider. I will say that many people that I've encountered have had some discomfort at first with their CGM on their body, but then they got used to it, and now with these continuous glucose monitors getting smaller and smaller and using them for longer periods of time, they become quite comfortable with it. And then, of course, comfort with technology. I will say that, sometimes technology can be overwhelming, but, our diabetes teams across the country are becoming more and more experienced with that, with helping you, as well as the companies that provide these continuous glucose monitors. They have lots of support, and it's becoming easier and easier to use. And I always tell my own families, with anything in life, sometimes it's great to try something once, and if you love it, great. And if you don't, keep thinking about it. You never know what you may be comfortable with, and don't underestimate yourself. You probably will do fine. So let's go on to a different topic. So let's talk about medications. So couple of other words that you may hear. So insulin. So insulin is made by our beta cells, and those are cells in our pancreas that are in our belly that control our blood sugar. And pancreas is an organ that is responsible for many things, but one of which that makes insulin. So what kind of insulin might you be on? There are many, many insulins out in the market, and they all have different lengths of time that they work. Typically, when a child is diagnosed, and adults as well, they can be on two main types of insulin, and one is called basal insulin, and it's a longer type of insulin that works over the course of a 24-hour day. Okay, and it's taken usually at the same time every day for control. Now there's bolus insulin, which are shorter acting insulins that work over 3 to 4 hours typically, but they can vary depending on what kind of short bolus insulin you use. And they're usually taken before a meal to correct a high blood sugar or help control your ketones if you're sick or ill. So they can be provided with insulin pens, or they can be supplied as insulin vials. There can be different concentrations of the vials. The pens can be reusable or disposable, but you want to make sure that you store them properly so that they are effective. A couple of other words that you might hear is gauge, which is like a thickness of the needle, and what we call a subcutaneous injection. And that means that you're just injecting into the fatty tissue versus a muscle injection where you're injecting in the muscle. And insulin is done by subcutaneous injection. So I'm not going to go into the details of all the how to do the insulin pen or the insulin vial, but I want to help understand that doing it properly with the right technique can help avoid any varying blood sugars that you have. And so it's really good to work with your team to make sure you have good technique. Different locations for insulin injections can include the arms, the belly, the legs, the hips, and butt area. And you want to rotate all of those sites as much as possible to avoid scar tissue. Because then if you develop that, your insulin may have variable absorption and may not work as well. So you may find that you have low blood sugar sometimes, high blood sugars, or it may not work consistently. So with insulin, you want to make sure when you're taking it that you have the right type and the form of insulin, making sure you're not taking the long acting versus the short acting. Just like Beyonce put a ring on it, you want to put a label on your insulin. Check the expiration date and the appearance of the insulin. And if anything looks off or it's expired, don't use it. And then use different sites of injections like we talked about to avoid scar tissue. So when we talk about short-acting insulin, there's different, we discussed that you can use it for meals, correcting a high blood sugar, and to correct your ketones. And that's typically what it's used for. And this is, this may vary a little bit depending on institution, but these are the general principles of the doses that you might be on. So one is the insulin to carbohydrate ratio. Basically, how much insulin do you need for the amount of grams of carbs that you take? So you take, that may be a particular number, which is called a carbohydrate ratio. And you take the grams of carbohydrates divided by the ratio, and that can be your dose. It could be rounded by half units, whole units, or it may not have to be rounded at all if you're using an insulin pump. You want to try to give it about 10 to 15 minutes before a meal, okay, depending on the type of insulin that you need. I'm not going to go into too much detail, but most of these short-acting insulins work within 10 to 15 minutes. Now, there are some newer, really fast-acting bolus insulins that work a little bit faster that can be helpful for patients who need to dose after meals because of their unreliable eating pattern or, any sort of different situations that require that. Now, you don't want to use this if you're taking carbohydrates to correct a low blood sugar. So if you are low and you're taking carbs to correct your low blood sugar, do not use this insulin to correct it. Then you have a blood sugar correction bolus. You have a correction factor. Just like you have a carb ratio, you have a correction factor. And that helps us determine, how much insulin that you need to lower your blood sugar by a certain amount. And this is important because if you need to use this dose often, your overall doses may need to be changed in coordination with your diabetes team. Typically, this is for injections, but you don't want to use it more often than every 3 hours. You might be careful about using it before activity, intense activity, unless you have found a pattern that works for you, or before bedtime unless instructed, okay? Or unless your blood sugar patterns are different that particular day. A ketone correction bolus is used to help clear ketones. Ketones are what happens when you have insulin deficiency, and that's what really gets you ill. And if you develop enough ketones, you can get what we call diabetic ketoacidosis, where the acid levels in your body build up, and you can get very sick and ill and come to the hospital. And so when you have ketones at home, you can give this extra type of insulin to help clear those ketones. And this is all part of sick day management or diabetes care. So in terms of technology, we talked about insulin pens and injections. So we can talk about insulin pumps. So insulin pumps are devices that deliver insulin continuously and with boluses under the skin. There are different types of pumps out in the market. They could have a tube, they could be tubeless, they could be associated with or without a continuous glucose monitor. And that's important to remember as our technology expands over the next decade or so. And then, of course, some of them have with or without remote monitoring in association with the continuous glucose monitor. So, what are the things that you need to consider when you're thinking about an insulin pump? How comfortable are you with insulin injections? The reason I bring that up is because when you're on a pump, hopefully you never have to be off of the pump. But for some reason, if your pump malfunctions or something's not working properly, you have to resort back to injections. You're going to have to remember and understand how that works and the relationship with pumps and injections in case you need to do that temporarily. And what features of diabetes care are you interested in? Are you interested in remote monitoring? Are you interested in advanced pump features? Are you interested in having, it tubeless because of your lifestyle? Touch screen, any of those kinds of things can, determine what type of insulin pumps you're on. How do you feel about having a pump on your body? Just like a continuous glucose monitor, everyone will have different preferences, whether they would like something like that on their body. Insurance coverage. I don't want to highlight that too much because we hope that, insurance or any kind of access does not prevent you from getting the technology and the care that you need, but it might determine what kind of insulin pump you're on. We definitely have a lot of advocacy, with giving that access to technology, to access to insulin, and access to diabetes care in general. Remote monitoring, we talked about tubeless pumps. Do you want to wear it with a CGM? And then, of course, comfort with technology, which is something that, a lot of families are getting really, really comfortable with. So different types of advanced pump options and benefits. These are just some examples. There are quite a few advanced pumps benefits and options out there with various providers, but these are kind of the standard ones. But then as you get to know the pump, you can do other things with it as well. Extended boluses are when you give a certain amount of insulin as an initial bolus, and then you can give a longer bolus over a period of time, depending on what you're eating or what your activity levels are. You have insulin on board, and that helps actually protect you from stacking insulin when a dose is given within a certain time frame. So if you already have insulin that's working, it will help adjust your insulin dose next time you dose. There's exercise and sleep settings certain times on these pumps, and it allows different blood sugar settings during specific activities. And then temporary basal rates. So what that means is that you have a rate that you normally use, but if there's a certain activity or event that happens, such as being sick or a prolonged exercise activity, you can increase or decrease your basal rates in lifetime or anticipation, for tomorrow or next week based on what you have seen on your activities of this week. So moving on, to the next pillar of diabetes care is nutrition. There's a lot of nutrition advice that a lot of people will definitely give you. I want to focus on just the basics of nutrition in terms of, reading your nutrition labels. That's the basic thing that you have to do when you first start taking insulin, and know your doses, plan ahead, and different foods to think about. So when you read a nutrition label, you want to know what your appropriate serving size is. What are the number of carbohydrates in that? That's usually expressed in grams. Now, a lot of times, homemade foods may not be available. There may be a certain meal that you created or somebody else has created that has a certain amount of carbs in it. And there's a lot of technology that we're going to talk about in a second that can help you with that. Sometimes insulin carb ratios are different for each meal and snack. You want to plan ahead. So access books, apps, resources when eating out. You want to ask if you go to school or you go to work, what are the policies for food, classroom parties, that sort of thing, because then you can plan ahead. And then of course, trying to count carbohydrates in homemade recipes. Foods to think about. You could have carb-free foods or low-carb foods available that may not require insulin. But one thing to remember is that sugar-free may not be carb-free. So you want to avoid, those kind of pitfalls because that can affect your blood sugar. So, just like I would advise any patient who has diabetes or who doesn't have diabetes, we want you to have a healthy diet. So we want to include fruits and vegetables, whole grain, and lean protein at each meal. We want to have that mixed meal to help you have the optimal blood sugar control. You want to be mindful of portion sizes. Having large portion sizes can affect your health long term. And avoiding high sugar and high fat foods. These are just general, of course, nutrition advice that we would give any child or any adult who's undertaking a dietary therapy. Okay. Don't forget about different condiments or supplements that you might be adding. Watch the plate. Are you finishing everything on the plate? And then, of course, write the type of food in the drink. So are you taking 2% versus skim milk? All of those have different mixtures of nutrition that could affect your blood sugars. Okay. But I think out of all of this basic talk about nutrition, I want you to understand that I want you to enjoy eating. There's a lot of blogs out there and a lot of really great advice from their own type 1 diabetes patients. This is just one example of a blog from a type 1 diabetes a person who has type 1 diabetes who's actually saying, bring joy back to your kitchen. So she has created lots of different wonderful recipes and trying to incorporate, food being a positive effect in your life. So let's talk about complications. As inevitable, not every day will be perfect. Not every day will be good. And so you're going to have sick days. You might have high blood sugars or ketones. You may have low blood sugar. And then other complications and issues to consider as we progress through life with diabetes. So some words that we might want to mention. So hypoglycemia means low blood sugar. Hyperglycemia means high blood sugar. Ketones, like we mentioned a little while ago, are produced when body breaks down fat and can lead to what we call diabetic ketoacidosis. And that's a life-threatening complication when glucose cannot be used for energy. And we want to definitely avoid that if at all possible. So there are going to be some days that maybe you have a low blood sugar. And we define low blood sugar as glucose less than 70. And sometimes children feel the low blood sugars and sometimes they don't. So it's important to know those signs. And these are just a few signs, but they can be very individualized depending on the child or adult. You can be shaky, nervous, weak, fatigue, dizziness, pale skin, sweating, confusion. They can have a fast heartbeat. They could even have just a mood change. It could be very subtle. You want to have snacks, glucagon, a meter with you, and very, very important, have a medic alert to know that you have type 1 diabetes and that you're insulin dependent so that people around you know what to do. So when you have a low blood sugar, you want to stop and check your glucose. Let others around you know if you can. And then, of course, you use remote monitoring if you're using a continuous glucose monitor. You want to treat the low glucose with 15 grams of fast-acting carbohydrate snack or juice. And then you recheck the glucose in 15 minutes to make sure it's normal. You want to keep repeating it until it's above 70. Okay. And then, of course, after you're above 70 and you're doing fine, you want to, look back on that and kind of just, have some, perspective of why that may have happened, so that maybe it could be avoided in the future. But of course, sometimes it's unavoidable, and to give yourself some grace. So this is just about traditional glucagon, and this is just how to take glucagon, and thankfully it's very easy. And we want to make sure that you give the glucagon, you call 911, and you keep checking blood sugars to ensure that it's normal. Sometimes you can use mini dose glucagon, and that's just giving a smaller dose. If for some reason you're at home, one particular example can be if your child or you are sick and you're trying to keep your blood sugar up by taking, something by mouth, but it's just not staying down, and you're not getting enough to maybe just get to a normal blood sugar. You could potentially help that out by giving a little dose of glucagon to help that. Okay. Now, there are newer forms of glucagon out there. One is called Gvoke, one is called Baqsimi, and that is intranasal glucagon that has been really helpful for a lot of families who are to treat their low blood sugar, because it's just a spray. So different types of complications, with sick day, you want to make sure that you keep taking your long-acting insulin. Now, it may need to be adjusted if you're not taking enough by mouth. Your blood sugars may be borderline low, and so we may need to adjust your insulin, but we don't want to stop taking it. You want to make sure that any medicines that you need, you take. If you have an infection or you need to take an antibiotic, you have any other medicines that you need to take, you want to, of course, take it, because that's going to treat your sickness or your illness. But you just want to know if there's any effect of those medicines on glucose. Okay, so then you can adjust accordingly. Now, when you're sick, your blood sugars are going to be a little bit high in general, whether you're taking medication or not. Now, carbs can be given in food or liquid form, and you want to make sure you drink plenty of fluid. And you want to check your ketones and your glucose regularly and give ketone correction if needed. So when you have high blood sugars, there could be a lot of varying reasons. It could be illness, stress, not getting enough insulin, missing insulin doses. It could be a certain type of activity, okay, that causes that. And some symptoms include, increased thirst, urination. You could be moody, you could be fatigued, and it's going to be individualized based on the person. You want to make sure that you drink carb-free fluids, you use your correction insulin dose if needed, and check for ketones. When you check your ketones, you can check ketones with a blood ketone meter, or you can check ketones traditionally with urine, okay? And with those urine ketone strips, you match the color on the strip to see how many ketones you have. With those kind of urine strips, you want to check the expiration date, replace after 6 months, and checking the expiration date always. And then if you feel like they're in extreme temperatures, then you replace it sooner. And if, let's say, you are checking your ketones, you give ketone correction insulin doses, and your blood sugars are still high, you're not feeling well, and you're just not going to be able to, treat this at home, you definitely want to seek medical attention, okay? So what other complications or what other things that we as a diabetes team think about when we see all our children in our clinic? We want to monitor growth and puberty. Now, when you don't have good blood sugar control, you don't have ideal blood sugar control, it can affect your long-term growth and puberty. And that's something that we want to monitor over time. We always, there's guidelines to check for, eye complications, kidney complications, cardiac complications. And then, of course, because, type 1 diabetes is considered to be an autoimmune condition, we want to get tested for other associated conditions and other autoimmune conditions such as celiac disease or Hashimoto's thyroid, which can cause thyroid problems. We want to check a cholesterol panel, and we always want to check blood pressure as well. These are just a few examples of things that we check for. And these are all based on guidelines for care. And it can be individualized based on your personal history and the practices of your diabetes team. So moving on, we want to talk about exercise and activities. Just like nutrition, we want to have healthy exercise goals. I would tell every patient, every child with type 1 diabetes to just have healthy exercise goals. And we want to know the effect of exercise and diabetes and their effects on blood sugar. So we never want to stop you from doing exercise and activities. We want to aim for at least 60 minutes of exercise a day to live a healthy life. If more, then great. If that's the type of activity that you're part of, then we will give you the tools that you need to make that happen. And exercise can affect glucose in different ways. Like mentioned before, anaerobic, aerobic activities, what type of level of fitness that you have, how often that you're doing it, and the type of foods that you eat before, during, and after can affect your glucose in different ways. And we check glucose before, during, and after exercise, which can be more helpful if you're on a continuous glucose monitor because it just interrupts you less. You want to keep an exercise log to see what patterns you have with different types of activities. So then that way you can take your diabetes care and customize it based on what you do. You want to keep all the supportive things nearby, such as glucagon, fluids, snacks, knowing all the support staff know that you have diabetes so they can help you if they need to. Know your symptoms if you have them. Try not to exercise alone if you can. It's always more fun with other people anyway. And then, of course, having a med alert to let people know if you need help and you need assistance that you have type 1 diabetes and that you're insulin dependent. So what are the things that are emerging in diabetes care? We talk about, an FDA approved looping design for integrating the continuous glucose monitor and insulin pumps with collaborations with different companies so that we can have an interface to have that kind of looping design. There is currently an open setup right now that allows a user to use an insulin pump and a continuous glucose monitor to participate in a do-it-yourself loop system. So I left this for last because I think it's very, very important to understand that, you're going to have challenging days. You're going to have fantastic days. And that we want you to know that it's not a life sentence. It's an opportunity for you to be fabulous. You can live a full and healthy life, and that it is an effort. It takes a village. Sometimes you can't do it yourself, and that is completely okay. We want, the basic tenets of this kind of coping mechanisms is to talk to others, share your experiences with others, which is why we're here today, which is the basic, principle of children with diabetes. We want to work together to help all of us be successful. And then, of course, seek resources, knowing where to go and who to talk to, whether it's financial, psychosocial, any type of support that you might need. Okay. I wanted to just highlight that, mental health and diabetes is complex, and it can encompass lots of different aspects of care. It can include traditional depression, okay? It can include diabetes distress, diabetes burnout, and then, of course, cultural and psychosocial factors can play a role in your mental health as related to your diabetes. Now, diabetes distress is important to remember because sometimes it can look a little different from traditional depressive symptoms. And it can be related, directly to diabetes. And so it's important to know that if you're having challenges, that you are able to share those experiences and challenges with somebody who understands these aspects of care so that they can treat and address and help you in the way that they need to. So I included a little bit about culturally sensitive diabetes care because that's what I do. But I think this is an emerging topic on how we can individualize care. Everybody is different. Everybody comes with their own customs, traditions, and background. And we want to know that these kinds of things can encompass communication and literacy, how we approach and think about and what perspectives we have on technology. Knowing your resources, what cultural resources are there for the diabetes team, and what resources can we give you in respect to your particular background to help we understand your care. And then, of course, engaging the team and the family together on any customs and traditions and family or home structure so that we can help understand you better. And I think that's super important. And I think we're starting to understand these things, in a more complex context so that, we get to give you more customized care. And this change comes from both sides, okay? Provider and family, okay? And we want to do a better job. And that's what my, part of my life's work is to help these families and children and adults thrive. So I just included some resources. These are resources on some emerging resources on cultural sensitivity and health equities. We want to reduce those disparities in care. And we're still starting to understand how we can be more culturally sensitive. So I just included some of these things so that maybe you can explore some of them. Locally, we have, Connecting Families at our Nationwide Children's Hospital. We have a Connecting Families peer-to-peer mentor program, which helps, and Family Advisory Council, which helps connect families with similar or maybe different challenges that can provide support to each other. And that's something that can be very helpful, on a local level, at your institution, on a regional level, or in a national level, just like, Children with Diabetes is. There's a lot of, language oriented resources. Through Diabetes is a community for Spanish speakers. There's stuff for diabetes camps. There's people for college diabetes, and then more general national organizations like Children with Diabetes, Beyond Type 1, and American Diabetes Association, just as an example. And then just, different lifestyle resources as well. And some of these are, technology resources. Some of them are nutrition resources. We had mentioned, emerging nutrition apps that take pictures of your food that help you, utilize that with your Dexcom or your continuous glucose monitor and your food to help predict what that particular meal will do when you eat it again. And so these emerging apps and this technology has been really exciting to help, people's lifestyles with type 1 diabetes. So, of course, we all know that there's lots of celebrities with diabetes, and we just want to make, know that you're not alone and that you all are a celebrity to somebody and to me. And I just wanted to highlight Charlotte Drury. She was in the news recently, right before the Olympics, because she got diagnosed with diabetes right before the Olympic trials. And she didn't think that she could do it, with all this overwhelming diagnosis and all the things that she needed to do to take care of it. She's showing her, I think, her Dexcom there. And so she decided to go for it, and she got all the support that she needed. And it was a really inspiring story to know that she actually ended up, going for the trials. And I thought that was a really great story that just recently happened this summer. So I just wanted to stop and say, you can do this. You can conquer the world. I think, it takes time. It's going to fluctuate. You may take a couple steps back. You may take 5 steps forward. But the important thing is that you progress over time. And so with that, I thank you for your time, and thank you for taking some time out of your evening to learn a little bit about diabetes. And I'll just take some questions and comments now, and I'll stop sharing so we can see if there's anybody that wants to talk about anything.
Thank you so much. I've been involved with diabetes for since 2007, but it's always nice to get a refresher, even for people who've been around a long time. So thank you.
Yeah, absolutely.
So I'm just checking. Do we have any questions from our audience? You can pop it into the Q&A if you have a anonymous question, or you can pop it into the chat. We'd be happy to answer for you. Will the recording be available to share with others? Yes. So after the conference, we will load all of our session recordings to the CWD YouTube channel. And then if you subscribe to the CWD weekly newsletter, the weekly diabetes that comes out every Wednesday, we do also feature a past recording from a conference session every week. That's been a new thing we've been doing. So please keep an eye out on the newsletter, and the CWD YouTube page will definitely post something once they're all up. One question. Thank you so much for your talk tonight. We want to adjust insulin to carb ratios, but how do you do this?
Yeah, and that's a great question. I think, the key to adjusting insulin carb ratios is understanding what types of foods you're eating and what that does to your blood sugars, because insulin carb ratios can vary based on the time of day, but also what type of foods you're eating, and then establishing trends and seeing if there's a particular time of day that your blood sugar is elevated. So as a basic example, let's say your blood sugars, you write down all your blood sugars, and your blood sugars, you're eating 3 square meals a day, you don't have any snacks in between, and your blood sugars might be elevated at lunchtime. Let's say you're not, things to think about, like your blood sugars are high every day at lunch. So things to think about, and things that I advise to my families is, well, what are you doing between breakfast and lunch? Are you having any activities? Are you doing anything? That sort of thing. Anything that could contribute to that blood sugar being high. But if nothing is going on, then what I would say is, if your blood sugar is high at lunch, it could very likely be because your insulin at breakfast may not be enough. Now, this is a very complex situation because there's a lot of things that play a role. So could it be your insulin at breakfast causing high blood sugars at lunch? Possibly. Could it be an activity, like I said, causing high blood sugars at lunch? Yeah, for sure. Another thing to remember, like I had mentioned, is the type of food that you're eating. You can have a particular type of carb ratio for a 30-gram carb meal. And then you could have a different 30-gram carb meal and use the same insulin carb ratio, but you know that both 30-gram carb meals are not created alike. And so having a mixture of protein, carbs, complex carbs, fat, all of those things can play a role in knowing whether that insulin carb ratio is working well for you, and whether those foods are affecting it more than the carb ratio. I know that was a long-winded answer, but looking for trends, looking for activities that can affect it, and looking for the type of foods that you're eating can also determine if we need to adjust your carb ratio versus changing something else in your diabetes regimen.
Well, it looks like we have one more question here, or a couple. What are your thoughts on low carb meals for kids or young teens? And then this might pair into the next question. How do you prepare for swimming? We always go low when we swim. We have an Omnipod.
Right. Okay. Well, those are great questions. So in terms of low carb meals, I will say that I think everyone will have a differing opinion on that. There are some, benefits to having maybe not having a carb rich meal at times, depending on your diet. I will tell you that, having a carb low carb meal may not be as, it may be more challenging if for some reason you are a vegetarian. That's just as an example. So because lentils, vegetables, all of those things have carbs. And so, we want you to have, I try to tell my patients that we want you to have a healthy diet. And not all carbs are created equal. And so while we want you to not be carb heavy, which I would say to any family or child with diabetes or without diabetes, we want to be mindful of the kind of carbs you're eating. So you can be low carb, but then still have an unhealthy diet. So I want you to put that in the context of, what type of carbs you're eating and make sure that you have a well-rounded diet. I will also say that, there are a lot of differing opinions on low carb and extreme low carb. I tend to be one of those people that will say, I don't like to be super restrictive on, I want you to be mindful of how you're eating, but I don't want you to be too restrictive because, we do need carbs. Carbs are good in certain aspects to grow because you're a child and you need those building blocks to grow and to go through childhood. And so that's definitely a discussion that we can customize with your local diabetes team to make sure that you have the healthiest outcome possible. In terms of like swimming, that's a great question. We always go low when we swim, and that's a very common occurrence. The good news is that you have an Omnipod, and sometimes depending on how long you're swimming, I have different patients who are just, swimming is, are you in the pool and you're just playing around versus are you a swimmer and you're swimming laps or you're in a meet? Okay, obviously those two things are going to, control your blood sugars in different ways. Depending on, what your blood sugar's doing during swimming, it could go high depending on your fitness level. It could go low 4 to 6 hours later. It could go low immediately after. Depending on what your blood sugar trend is during and after activity, you can adjust you have an Omnipod, you can adjust temp basals. You can adjust, you can give snacks before meals. You can give snacks during the activity if you are able to. Those kinds of things, you can give, there's a lot of just different variations that you can do to help stabilize your blood sugars during activities. A lot of people I tend to want to have blood sugars above 100 before activity. And so but that can vary from different providers. And so having a certain type of snack that's complex right before you swim potentially can also help you while you're swimming as well. So it's just going to be with any activity, it's going to be a little bit of a trial and error to figure out what works for you.
Awesome. Well, I think that's as many questions we're going to be able to get tonight because the next session is starting. But I want to thank you, Dr. Ghandi, for joining us tonight and being here with us for Fall Friends for Life 2021. We really appreciate it. And just so everybody knows, our next session is starting now. So if you're heading over to the carb counting session, the room just opened up. We'll invite you over there. And we do have an open hallway tonight from 9 to 11 p.m. So feel free to pop in, chat about whatever you're thinking about, whether it's whatever the 100th anniversary of insulin means to you, or, your favorite bolus-worthy food. We'd love to hear about it. So thank you again, Dr. Ghandi. And thanks to everybody for joining us tonight.
All right. Thank you, everybody. Have a good night.
You too. Bye-bye.
Bye.